Lawton Show on AM980.
Welcome back to the program. This is the Andrew Lawton Show here on London's breaking news leader. I have spoken on this program a number of times in the past about healthcare, and frankly, there's never a shortage of things to actually talk about when you're dealing with healthcare in this province, from issues with wait lists to issues with lack of services to issues with people in certain parts of the province not having access. We've seen and heard and experienced, all of us, either firsthand or through someone we know, someone who has found that the system is not serving them. Now, when you have a universal healthcare system and you only have one place that you can go for healthcare, that means that if it's not working, people are in a very problematic territory. Now, I know that everyone here likes to have perhaps a little bit of a complaining fest when it comes to things that this provincial government is doing. When we're talking about healthcare, though, this isn't about politics. This is about health. It's about, should be anyway, about health and wellness. There is a little bit of hope on the horizon, though. There are a number of doctors in this province who are trying to draw attention to this. People from inside the system that have navigated or attempted to navigate the system who are rising up. The group is called Concerned Ontario Doctors. They have a Facebook group that has over 20,000 people in it, and they're drawing attention to a lot of the issues which are not just happening in other parts of the province. We see them happening here. And I'm very pleased to actually have one of these physicians in studio with me now, Dr. Andrew Liu, who is a radiologist working at hospitals in London. Dr. Liu, I really appreciate your time today. Thank you for coming on.
Thanks for having me, Andrew.
I've spoken to a lot of people directly on air and off air who have had issues with accessing care. I don't want to bore everyone with my story again, but I have spoken in the past that I actually had a stroke well on a waiting list in Ontario for a cardiologist appointment, which was something that I was told even after the fact shouldn't have happened given where I was and what I had been diagnosed with. But these are not isolated incidents anymore. We're seeing more and more patients who maybe not as dramatically or maybe more dramatically are having problems with this. So as a doctor, I mean, we hear about the patient side of this. No one really realizes that doctors are equally frustrated seeing this because it doesn't sound like the physicians are able to really fix this themselves.
That's exactly it, Andrew. And thanks for bringing that up. Now, we've organized over Facebook because we watch patient suffering, patient access being reduced, a wait list being increased as we're powerless right now to do anything about it because of the gross fiscal mismanagement by the government and the underfunding to our healthcare system. We're watching as clinics are closing, doctors are leaving, ORs are being shut down, nurses being laid off. You want a hard example? Look no further than locally, in London, for instance. Dr. Bob Litchfield, head of Fowler Kennedy, was featured in the London Free Press, where ORs for joint replacement are being shut down because there's gross underfunding for the hospitals as hospital budgets are frozen.
I have to ask, though, because we hear this from a lot of different groups about underfunding, but then on the other side, we see some people in like CCAC, for example, executives that are making exorbitant salaries, more than a lot of doctors, in fact. So is the problem that there isn't enough funding, or is the money just not being spent intelligently?
And again, another great point where you mentioned the CCACs. Apparently those are being abolished, and that sounds good on the surface, but they're actually creating 80 sub-LHINs or sub-local health integration networks, and thus adding an additional layer of bureaucracy. So where's the money going? Bureaucracy, as well as scandals, the gas plants, the e-health, the pandemic executive payouts, Orange, not to mention the Sudbury bribery scandal, as well as the gas plant data cover-up. There was enough money to pay for everything in healthcare and our aging complex needs, yet it's going, again, to scandals and fiscal mismanagement.
So I guess this brings us to a question of how it really got to this point, because we know that healthcare occupies, one of the biggest chunks of the budget in Ontario. It's arguably most important. I mean, healthcare and education, I think people typically put up there as the ones that are most important, although with healthcare, there is in a lot of cases a more imminent need there. Is this something that's really just been happening in the last, 12 years under this government, or have we seen a slower, longer decline?
I think it stems back all the way to at least 2012, where negotiations start to break down. The government gave us a deal that in which it did not cover enough patient care. It did not secure enough patient funding. The OMA, Ontario Medical Association, all doctors realized that, and we refused to accept their deal. And after talks continued to break down, they impose unilateral actions, unfair, cumulative cuts, and thus just essentially impose their will without talking to doctors, without talking to frontline healthcare workers. Bureaucrats making decisions on your health, your lives, without ever seeing a patient themselves.
And that's a really big part of the problem here, is that, as you've touched on, we have the people making the decisions are not the people that are really on the ground understanding it. Now, I know you haven't been a doctor for decades, so you haven't seen, how things were, 20 years ago versus now. But I am wondering, has there been, that you're aware, much in the way of consultation with physicians, with nurses, to really help with the policy, or has this been entirely top-down?
As you said, the latter, entirely top-down.
Wow.
These are unilateral actions imposed by the government and without talking to frontline healthcare workers. We as doctors have said repeatedly, we are willing to talk. We are willing to negotiate fairly, but they refuse to negotiate fairly and give us binding arbitration. And of the meetings that we do plan, for instance, just ask Dr. Michelle Jacobson-Raby, who planned a meeting with Dr. Eric Hoskin months in advance, and at the last minute, he actually canceled the meeting. So they refused to talk and negotiate, as well as cowering away from the meetings they did plan.
One other problem, and I don't have the numbers available instantly, but there was a report that came out, I think it was a year or two ago, talking about the number of doctors who leave Ontario. A number of them, a really sizable percentage, go to the United States. Some go to other provinces. Is this something that you've seen personally with people with whom you were in med school, or other doctors, where they're just finding, greener pastures elsewhere?
Yep, that's exactly true. And that was, in some ways, true before, but now it's getting worse than ever. Doctors are leaving. Ones that would have retired later are retiring early. New grads are being prevented from actually joining teams and starting up in Ontario. Active doctors are leaving, as you said. And some hard evidence, Dr. Brenna Velker did a study where she asked family medicine residents if they were going to stay in Ontario. At one point, 90% said yes. Now, only about 33% will actually stay. 800,000 Ontarians are without a family doctor. At the beginning of 2015, we know that number has risen to nearly 1 million. They've cut 50 residency spots. So now access will be even more diminished. Things are getting worse by the minute, and wait lists will continue to grow.
Yeah, I wanted to talk about the waitlist side of this, because I mentioned very briefly at the top of the show, this is obviously an area where I've had to learn the hard way that there is, in fact, a problem there. And I've heard from people that have had just awful, awful stories. And we're not even talking about, the examples we hear of all the time of people, waiting years for orthopedic surgery, but MRIs, things that can be very important, things that are often necessary before life-saving treatment or a diagnosis is given. What is the reality that you've seen here in London? Because I think a lot of people have this belief, and what we hear from the government is that, well, in some parts of the province, like, Thunder Bay and, way up in Kenora, they have problems. But we're seeing this in urban centers like London as well, are we not?
Absolutely. So I gave you the example of London ORs being shut down, being empty while patients are suffering. That's not only happening here. London's a major center, but it's also happening in Strathroy, St. Thomas, Woodstock, the same thing. ORs being told to shut down. For a clinic level, multiple clinics have been shut down all across Ontario. GTA, a nephrology clinic was just shut down in Peterborough, 8,000 people affected. Because of the underfunding, thus we can't pay the rent, can't keep the lights on the building. We have to lay off nurses, staff, receptionists, occupational health, anyone who's working with the clinic. And thus, whether you have to reduce hours or close the clinic, things will only get worse as access is decreased, wait lists increase, and people just flood the hospital system, and thus exacerbating the problem again.
I know your focus, obviously, and your experience is on the system in Ontario, but I'm wondering how Ontario ranks against other parts of the country here, because we know that obviously there is a universal system in Canada. All provinces have a similar approach to the way they do it, but each province is tasked with its own budget, its own policy. So do we know where Ontario is in terms of other parts of the country? I guess to put the question in another way, are we really worse off than other parts, or is this a national problem?
I think it's a problem that's certainly exacerbated and worse in Ontario.
Wow.
I mentioned some of the data and some of the numbers there. Again, if 800,000 doctors or 800,000 patients are without a family doctor, and that number is increasing, and we're cutting residency spots, and we know that wait lists are only going to be increasing. What was, for instance, again, joint replacement, cataracts, any elective surgeries, what once was maybe a month is now the wait time could be years.
What would, I guess, for the stopgap measure, at least something that could be done more imminently, could be done to put things on a right track? Because a lot of the issues that you're raising come back to money. You know, there's not enough money in this, not enough money in this. But if the government were to say tomorrow, okay, we have a check for whatever dollar amount, we're going to put this towards whatever it needs to be. Where do you think that would be best serving Ontarians here? Where's the biggest area for growth imminently?
Okay, so that is so for starters, I think, number one, negotiate with doctors. They've done all of this unilaterally, where we've been willing to negotiate fairly with binding arbitration this whole time. And to answer your question, it can go to a number of issues like frontline healthcare workers, which have been cut, chronic disease management and addictions medicine have been cut severely. ORs, ones are being shut down. Give funding to them. They've been operating efficiently and properly and getting people off wait lists, yet they're being told to shut down because there's not enough funding. So I think it starts with negotiating fairly with binding arbitration, and then from there we can work out with just a few examples mentioned there, exactly where it could go to best serve patient care and access.
Chatting with radiologist Dr. Andrew Liu, who works here in London, about some of the challenges in the healthcare system. He represents Concerned Ontario Doctors, a group of physicians that is really committed to trying to fix some of these very issues we've been talking about. I want to get a little bit more in depth when we come back from the break here about where we go from here knowing this. We'll have more with Dr. Andrew Liu in just a couple of moments here on The Andrew Lawton Show on AM 980. Stay tuned.
This is Canada's most irreverent talk show, The Andrew Lawton Show on AM 980.
Welcome back to the program. Joined live and in studio by Dr. Andrew Liu, a radiologist and a spokesperson for Concerned Ontario Doctors. We don't often get people in studio, so thanks again for coming in, Dr. Liu. Really appreciate it.
Much appreciated, Andrew. Thanks for having me.
So we're talking about some of the issues in Ontario healthcare, and I wanted to give a little bit of hope for people. You know, we always like to uplift and be optimistic here when possible. When we're looking at changes that could be made, have you even been met with any willingness by the government to really talk about these? Or is that still a goal that you're trying to get embraced for them to even listen to what's going on?
So with our group, we've written dozens, if not hundreds, to thousands of letters now to MPPs. We try to schedule meetings. We try to get the word out on social media with our website, Carenotcuts.ca. We are your Ontario doctors on Facebook. But when we do try to talk with the politicians, they either send us back a canned form letter denying all their lies, or they refuse to negotiate fairly with the Ontario Medical Association and give binding arbitration. Even the meetings, like I mentioned earlier, that we set up, they back away from, especially Dr. Eric Hoskins, who backed away last minute after a meeting was planned for months, in which he invited us.
So when we look at the challenges in the system, one of the things that we brought up in the last segment was that, okay, money is always going to be short. There's always going to be in government more things that they want to spend money on than they have the money there for. Is there a problem that could be remedied more long-term with the actual delivery, with the actual system of healthcare in the province itself? And I'm not asking you to say, yes, we need to, raise this by 2%, drop this by 10%, and change the funding model altogether. But are there actual changes that your group has seen where we could see a more positive outcome just by changing the way we view the system itself?
I think that is a great question. And one thing we noticed that there's way too much bureaucracy. I mentioned earlier that the CCAC, or home care, is now being reduced or changed to this 80 sublins, or local health integration networks, and increasing the funding to more bureaucracy. And so if you save the money there and then redivert to actual frontline healthcare workers, clinics wouldn't have to close and ORs wouldn't have to shut down, and we wouldn't have this problem of patient access and increased wait lists.
One thing that has really, I think, jumped out at me, and I've heard you mention this as well when we were chatting beforehand, and I've heard another doctor that I know say this as well, which is that for doctors themselves, there is this frustration that they're seeing this and it's happening and no one's doing anything about it. And for doctors, you're the ones that see the patients that are on the wait list. You're the ones that see the patients declining. You're the ones that are trying to advocate for your patients but are up against a wall. So on a more personal level, how does that feel as a doctor when you've taken the oath that everyone knows to do no harm and you're seeing the system fail people?
I would hope that everyone has a physician who's caring for them and doing the absolute best they can. I know I make an effort to see patients, and when I do, I see them telling me that they're waiting longer to see their specialist to get diagnostic tests. And we are frustrated because we feel powerless because we cannot strike. The government has made it illegal for us to strike. We have no union. We have a lobbying group and a negotiating group through the OMA, but the government has made it essentially illegal for us to fight back. So we are reaching out to people in media like yourself, Andrew. We are getting people right to their MPPs and let them know how angry they are, how Eric Hoskins and Kathleen Wynne are mismanaging just about everything. So we can do these things, but the government just tries to ignore us, deflect us, but we can't stay silent any longer, and we have to sound the alarm bells.
But are you saying, though, that there is a contingent within the medical community in Ontario that would like striking to be on the table? Because I see that would be probably something that would force patients to turn on doctors and see them as the bad guys in the equation.
That's exactly it. We've certainly thought about that, but because it's illegal, we're putting that on. We're not really considering that. No doctor wants to put patient care, patients in the way of this war. We don't want to leave our patients. We don't want to stop working. And the government knows this. So they're using that almost as a way of leverage to keep us working in these hostile conditions. So
One point I want to bring up here is that we have obviously a problem here that you've laid out, and I think most people listening, I would hope, would have to agree with that, although my sincere hope is that people haven't had to endure it the hard way.
Agreed.
What can people do? Because you've described that even as having the weight of doctors in the province of 10,000 doctors, you can't get the government to really listen. So what options are on the table to really enact change here?
So we're a group of 11,000 strong, mobilized on Facebook, but there are 13.6 million Ontarians, with more increasing every day. We need you, the public, to write to your MPP and let them know how reckless and disorganized and painful these cuts are. We need you to write to Eric Hoskins, to Kathleen Wynne, and tell them how terrible these cuts are and how they're affecting you. Because you, the voters, the taxpayers, the patients, need to get involved, and we need your help. You can visit Carenotcuts.ca, our Facebook group, We Are Your Ontario Doctors, and follow us on Twitter, On Call for ON, where you need to get involved, and we need your help to let the politicians know exactly how they're affecting you.
We're coming up to the end of our time together here, Dr. Lou, but I wanted to ask you, with another provincial election not coming for the next couple of years, are you really hoping that this cause will be front and center when that next election comes around?
Absolutely, Andrew. It's front and center, and it's at a crisis point right now. In 2018, we hope that this will be front and center because it truly affects everyone. We want them to take action now. We don't want them to hopefully hope for the best and hope for everyone forgets all their scandals and this crisis in healthcare when the time comes. We need people to know now. We are grateful for people like you for having us, and we need Ontario's patients to get involved.
Well, I'm grateful you were able to come in today. Dr. Andrew Liu joining me on the line, a radiologist at LHSC and part of Concerned Ontario Doctors. Dr. Liu, best of luck with all you're doing. I really do appreciate your time today.
Absolutely appreciate it. Thanks for having me, Andrew.